Healthcare careers shouldn't be a mystery, and they shouldn't be reserved for people who already have connections or know the right people. My name is Tanvi, and this is Healthcare Unveiled, where we have honest conversations with healthcare professionals about their real journeys, the good and the challenging parts, so that you can figure out if and how this path might work for you. Hi, Dr. Santosham. Thank you for being here today.
Yeah, very nice to talk to you.
Thank you. Nice to meet you too. Just to begin with, can you tell us a little bit about your job and what you do and how you got into it?
Yes, my job, and I'm actually in the phase of retirement right now. So I'm now 81 years old, but a lot of people ask me, why haven't you retired yet? My answer about that is always that retirement is doing what you enjoy most. And this is what I enjoy doing most. I became a doctor in India, and during my medical school years, saw a lot of children dying. This is in the 60s, in the early 60s. Almost during my pediatric rotation, I would see a kid dying in here and a kid dying there, all in front of me, and the mothers pulling, we all had to wear white coats those days, pulling my white coat saying, please come and help my child. His child is dying. I say, I'm coming. By the time I get to the kid is dead. And I used to just think to myself that something has to be done about this. They can't let kids die like this. And at that time, there's no such thing as oral rehydration solution. Oral rehydration solution is known in this country as Pedialyte, which you might have heard about. Those days, you can imagine, this is the 60s, there were not enough IV fluids. And this was a medical school I was at. Even there, we didn't have enough IV fluids. We did not have disposable equipment, and we didn't have enough. It was myself as a medical student and a nurse trying to put in all these IVs, and kids would keep dying of dehydration right in front of my eyes. There is a related story, which, if you don't mind, I will actually tell you, which has shaped my decision to be a doctor all my life. When I was 5 years old, this is back in 1949, my father was posted to Kathmandu in Nepal. And those days, getting to Kathmandu was a real challenge. We were in New Delhi. My father had just joined the Indian Foreign Service. We had to go by train for 2 nights to Calcutta, and then an overnight journey on a bus to the Nepal border. And then either you walked for 7 days as an adult or as a child. I was carried in a basket, and there was a purse. They called it a dandy. There was a pole on either side of the basket. The guy in front and the guy in the back, and the basket would just go back and forth. And, we'd go around these valleys around the hill, and I would look to the side and see, and my goodness, if they flipped me over, that would be the end of it, because there were no walkie-talkies, nothing. But anyway, long story short, we reach Kathmandu. There are no schools to speak of those days. So they sent my elder brother and sister all the way back to India, to my grandparents' house to study. They tried to send me back several times, but every time I would cry and my mother would bring me back because I was the baby of the house. And the reason I tell you that story is when I was five, my mother took me to the local market in Kathmandu. You can just imagine what the markets were like those days. All the women, mostly women, sitting on the floor with baskets. There was cow dung everywhere, banana leaves, flies. My mother holding my hand saying, one day you should become a doctor and help all these children. That stuck in my mind. So that is what I wanted to do. Eventually, when I was 8 years old, they sent me to India to study, and it was extremely difficult for me. I really had not studied, and one of my uncles was a lawyer in South India, Madurai, took me to a local British convent and told the headmistress, her name was Sister Rose. She said, Sister Rose, I'd like my nephew to be admitted. And she said, of course, no problem. What has he studied? He said, well, that's a problem because he hasn't really studied. So it was even difficult for them to figure out which grade to put me in. And eventually they put me in a grade class 4 is what it was called, and I was struggling to catch up because I had not really gone to school at all. And I'm almost catching up. And then my father gets posted to Bonn in Germany because Berlin wasn't open at that time. That was another big journey. I had to go from this little town of Madurai to what was called Madras at that time, now called Chennai. And then 2 nights journey to Mumbai. Then a 2-week journey on a ship to Marseille in France, and then an overnight train to Bonn. In Bonn, unfortunately for us, there were no English-speaking schools except an American school where it was too expensive for my parents to send us there. So they sent my brother and me to a boarding school in Glasgow in Scotland. And I can tell you, Glasgow in the 50s was a miserable place. Very, very cold. No central heating, no hot water. And if you wanted to actually bathe, you had to sign up in the boarding school. You could only bathe 1 day a week. Anyway, now again, they had to decide which grade they're going to put me in. There was an exam called the 11 plus exam. I was 12 years old. At age 12, they made the decision based on a competitive exam to decide whether you are smart enough to go to high school and go on to a profession. And the grading system was S1 to S3. You had to get S was a pass. S1 was the brighter end of the smart kids. J1 was the brighter end of the dumb kids, and J4 was as dumb as you can get. So I wrote the exam, and unfortunately I got a J3, which is next to the worst grade. So the headmaster called me in and said, Mathuram, what would you like to do? I said, I want to be a doctor. And he said, no way, that's not possible. You can become a carpenter or an auto mechanic. And I just started crying. And bless her heart, my primary school teacher, Miss Grant, came and said, go back to the class. I want to talk to the headmaster. And they were arguing back and forth. Eventually, she came back and said, I have convinced the headmaster that we should appeal to the board to give you a second chance. And because of her, I went from a J3, which is the second to the last, to S3, which was the minimum passing grade. Because of her, I went to medical school. And the reason I even mentioned that story, because of her and my mother, the two people who are most influential in my life and getting to where I was, is to, and I say this to all my students, you must have big dreams. You don't limit yourself and say, I can only do this, I can do that. And then you need to be persistent. And you should always remember that whatever position you are in, there's always somebody you can help. And if it wasn't for Miss Grant, I would never have become a doctor. And I will tell you how my career then went down from there. Because of my work, literally, I don't say this to boast, millions of children have been saved. And in turn, I have been able to mentor juniors from all over the world and also in this country. And they are now in leadership position and they've saved many lives, all because of Miss Grant, who was a simple primary school teacher. I don't know what her salary was. It must have been minimal. I could not pay for my own, pay for her tuition or anything. And so I always tell everybody, any opportunity you can, even at your stage at high school, mentor somebody else, who is less fortunate than you. Do you want me to go on and say what happened after medical school?
Yeah, go ahead.
Yeah. So I wrote at that time, in order to come to the US, and I think it's called something else. It was called the Educational Council for Medical Graduates, ECFMG. I think now they call it Flex Exam or something. I wrote the exam. It couldn't be written in India, so I actually had to go to Sri Lanka, at that time called Ceylon. I wrote the exam and passed the exam. I had actually even at that time had not planned to leave India. I was somehow thinking I could work on diarrhea in India. But I had the opportunity. I passed the exam, came to Baltimore. It was almost impossible for foreign graduates to get into a teaching hospital. Of course, I applied to Hopkins. They pretty much rejected me immediately. I applied to all the major universities around the country. Nobody took me. And then the only place that took me was a small hospital called Church Home and Hospital in Baltimore.
Mm-hmm.
I realized as soon as I got there that this was not really a teaching hospital. They were using foreign graduates to do the scut work for the private practitioners. And my job was to do the physical exams, write the histories, take blood pressures, write sleeping pills. And I was so disappointed. And again, I applied, and of course, nobody took me. I applied to Johns Hopkins, and they sent me a standard letter saying, "You received your email." I mean, no email. There was no email. Received your letter. You're welcome to come to an interview if you like. And so I thought, gee, that's very exciting. They're willing to interview me. And I went. And about the third person who interviewed me said, "Doctor, I want to tell you, you have no chance of getting in here. We just don't take foreign graduates." Those days they could make statements like that and get away with it.
Yeah.
I was very disappointed. And then there was one of the doctors whose patients I took care of liked me very much because his patients apparently told me that I took very good care of them. And because he liked me so much, he said, "What do you want to do?" I said, "I want to be a pediatrician." And he said, "Apply to Johns Hopkins." Of course, I applied. They didn't take me. He said, "Well, that's too bad. But I do know another doctor, Dr. Harold Harrison, who works in a hospital called Baltimore City Hospitals. And he is very well known for his work on diarrhea." And I thought that was very exciting for me. So I had an option I joined there. He did take me, Harold Harrison. And because of his mentorship, I got interested. I told him that I'm interested in diarrhea and dehydration. He happened to be one of the world's experts on fluid and electrolyte balance. I worked with him and then worked with another person at Johns Hopkins, also a very famous person on diarrheal diseases. And they both inspired me to work on oral rehydration therapy. And that's how we started doing these studies on Pedialyte. And then just about when I finished my residency, one of my professors, Dr. Bradley Sachs, said, "I have a project in Calcutta in India to do research on diarrhea." And of course, that was very exciting for me. And he said, "Would you be interested in going there and working there?" My wife's also a doctor. She's an anesthesiologist. We talked about it. We were very excited. We were about to leave for India, and the Indo-Pakistan war broke out. You're probably too young to remember all the wars that have gone on between Pakistan and India. Almost every time in those days, U.S. would support Pakistan, and that's a long story why they did that. But anyway, India was very upset that U.S. supported Pakistan. They said all U.S. programs must leave right now. I was totally crushed because this is what I want to do. And I remind young people like you and others that, disappointment is part of life. And sometimes the biggest disappointments in your life will become the biggest assets in your life. That's exactly what happened to me. And this doctor said to me, "I know, too, they still call me Mathu. Mathu, I know that you're disappointed, but I do have this project at the White Mountain Apache Indian Reservation, and they have lots of diarrhea. Would you be interested in going there for a year, and hopefully by then things will clear up in the U.S., in India, and you can go back?" And talked about it with my wife, and we prayed about it, and we decided we will take up the offer. And that's probably the best thing that happened to me in my life, because that changed not only my career but also our lives, because we went there, lived among the Apache Indian people, and they had such rates of diarrhea that I couldn't believe. They were having rates of diarrhea and children were dying. Every week I would see kids who were dying. And I was a clinician. When I first got there, I was there to do research on diarrhea, and one of the doctor in charge, the medical director, said, "We have so many kids dying. We don't have time for research." I said, "That's fine. Can I just help you? Because I'm a pediatrician, I can help you." And so I did just clinical work initially, just trying to save babies. And I don't know if you know that when you have diarrhea, you lose water and electrolytes, right? And that's what you need to replace. And it was used for decades. It was only done with IV fluids. So we now, and once I got there, I trained them to use what is called Pedialyte in this country now, but mostly that wasn't being used. And when a child gets really dehydrated, all the veins collapse. You have to do a surgical procedure called cut down in order to find an IV line. And then when I was in Baltimore, if you needed a IV line and you need a surgical procedure, you call the surgeon. First child I saw, he said, we need to cut down, and the nurse handed me a tray. I was expecting they'll call a surgeon. There was no surgeon. So I either had to do the procedure or the baby would die. Fortunately for me, I was successful in that baby and saving the baby. And then I had to do many more of those. And very soon, I immediately set up these programs and trained community health workers who live in the community to use this solution. We distributed to them in a packet, and they just mixed it with a liter of water. And that completely eliminate the diarrhea deaths. And that lesson was taken all around the world, and people started using oral rehydration solution. And while I was working on this problem of controlling diarrhea, there was a big epidemic of diarrhea, which caused by a virus called rotavirus. I don't know if you've heard of it, but that's one of the most common causes of diarrhea in children. And while I was taking care of all these children with diarrhea, several cases of meningitis came in. Meningitis is an infection of the brain, which results in death in many children. Those who survive, many will get neurological consequences. They might lose their vision, they might lose their ear, they might get paralysis. But anyway, when I saw these cases coming in, I realized the attack rate of this disease was astronomical in this population. So I had come there to work on diarrhea. I was not an expert on this disease. I then called around and called some of the experts. It was actually caused by an organism called Haemophilus influenzae type B, HIB, like in boy, not HIV. There was no licensed vaccine in the US at that time. I then worked with a physician from Harvard who had actually developed what's called passive immunization, which is what's given when we don't do it anymore. When you get exposed to hepatitis B, you always, to prevent other people from getting it, family members getting it, they will give antibodies. And the way the antibodies were developed was to give an adult the vaccine. Adults would react to the vaccine. And almost all the disease was in children below 5 years and 90% with under 2 years of age. The adults would develop a response to the vaccine. Then you bleed the adults and then give the antibodies to the baby. So I managed to get that product and actually do a study using a product my colleague at Harvard had developed. And we were able to show it prevents meningitis. But unfortunately, with passive immunization, it's not the baby who's making the antibody, it's an adult, and you're using that. So we had to give a huge volume. It was like 5 cc per kilo, and it cost about $100 a dose those days, which is a lot of money. But then fortunately, the next generation of vaccines came along. It was called the HIB conjugate vaccines. And I did one of the first studies to demonstrate that this vaccine prevents disease. And that vaccine was then licensed in the US and is now used across this country. And I got because my passion was to get this out to India and all the poorest countries, I got a $30 million contract to actually promote this vaccine around the world. And I'm glad to say that every country in the world is now using it in their general immunization program, except China. But even in China, majority of the children are receiving it in the private sectors. And the disease has almost disappeared. I'm just very grateful for the opportunities that I've had. But if I can give a message to the young people, I don't know who will be watching your podcast, is always dream high, aim high, and always make sure that you're not afraid of failure. Success often doesn't come the very first time you try something. Winston Churchill, you might have heard of him during the Second World War. He said, success is going from failure to failure without losing enthusiasm. you must not be afraid to fail. And remember that when you're going up that path and trying to climb a mountain, there will be failures. And when you fail, the most important thing is not feel sorry for yourself, but to get up again and try to learn from why you failed, what happened that didn't allow you to succeed. And and everybody has their own faith. I have a very strong faith in a higher power, but you must look for strength from beyond you.
Mm-hmm.
Look for whatever you believe in, whatever higher power you believe in, and keep on going until you reach your destination. There is an old song which your generation would probably never have heard about. It's a song called To Dream the Impossible Dream from the very old movie called Man of La Mancha, which was popularized by a very famous singer in those days called Jim Reeves. The words were, to dream that impossible dream. That is what I want all young people like you to do. Is dream big, think of others. Always when you're on your path, try to bring along someone else who's less fortunate than you. You may not have had the opportunities that you've had. And don't be afraid to fail and keep your eye on the ball. It is so easy to get distracted because often when you're going towards a destination, you'll get criticisms. People say, why are you doing this? And I always say the Mahatma Gandhi said that the only tyrant I fear is that impossible tyrant inside of me. In other words, if you can satisfy yourself, what you're doing is right, and you're working towards the right goal, you shouldn't worry about criticism. Florence Nightingale said many years ago, when one of the young professionals wanted to go to India and work on sanitation, she said, you will face great opposition, but great works do not prosper without great opposition. You shouldn't be afraid of people criticizing you. And just most importantly, dream big and keep your eye on the ball. So that's my message to the young people.
Thank you. Your story is really inspiring. Thank you. The meeting's actually going to end in 10 minutes, so if I can just ask like one more question.
Sure.
I saw on the website, if I'm right, that you established the Center for Indigenous Health at Hopkins.
Right.
So I was just wondering, what kind of inspired you to go on that route after everything you just described that you went through when you first came to America?
Thank you for asking that question. When I finished doing the meningitis study, I realized, even though my expertise is infectious disease, that these people have so many other problems. And I was no expert on all these things. I talked to my head of my department, the dean, and said, I'd really like to help these people. And they said, why don't you start a center that specializes on American Indians, and you can use the expertise of the whole school, because the school had experts in various specialties, including mental health, chronic diseases. And mental health was a huge issue in this population. Diabetes was a huge issue, so I decided to start a Center for American Indian Health. Did I send you my short bio?
No, I saw it on your website though.
Okay, good.
Yeah.
That sort of summarizes what I've done.
Yeah, let's see what else. How do you navigate kind of the intersection of traditional healing practices versus modern medicine within your work?
Yes, that's a great question. The only reason I was able to do all this, myself and my whole family lived on the reservation, right where they were living. They became our neighbors. We went to the same church as them. And whenever a child or anybody died, they would have what's called wake, where they celebrate the person's life for 4 or 5 days. We participated in all of that. The most important thing when you're in a cross-cultural situation is to respect the local culture. And even though I came there as an expert, I realized very quickly, I may be an expert in my field in medicine, but I'm not an expert in that community. They are the experts. You need to listen to them. And often it may not seem to you like what they're doing is the right thing, but there's a reason why they're doing it. That's been passed on through generations. And you must be willing to listen and be humble and learn from them. You obviously have something to offer them, but don't assume that you're an instant expert on their diseases.
Yeah, thank you. I just wanted to say thank you so much for coming on the podcast. It means a lot.
Yeah, and feel free to contact me if I can be of any help in advising you.
Yeah, thank you so much.
Take care. Good luck with your career.
Thank you.